now is near the sea, baptizing Jesus. He speaks the truth, being hard to share. Oh yeah, the voice of Jesus, sweet as notes in Sarah's song, sweet as name on mortal tongue, sweet as carol heaven
you, choir. Let's rise up as we all take the doxology. Praise God from whom all blessings flow. Praise Him, all creatures near below. Praise Him above the heavenly host. Praise Father, Son, and Holy Ghost. Amen. Amen. Let's be seated.
Good morning, church. Praise the Lord. Today is Medical Sunday. Every year, the Baptist Convention sets a week out of 52 to celebrate Health Week. And the purpose is that, just as it is said in John 3, verse 2, I wish above all things that you prosper, just as your soul prospers. So it is important for Baptists to be able to check themselves. The Health Week is not just to sing, come for urinalysis or whatever test you want to do, or check your blood pressure. It is that you yourself, you take it upon yourself to go to medical labs, do some series of tests, and then see a doctor who will interpret those tests for you. So this morning is our turn to hear what the Baptist Convention, the topic is you and your liver. First slide. The liver is the largest, is the largest internal organ. It's not the largest all over. The skin is the largest. But the liver is the largest internal organ in the body. It weighs about 3 pounds, or if you want to convert it to kilograms, 1.3 kilograms. It is located at the right upper quadrant. This is here. Hidden beside or inside the lower rib cage here. It receives blood. In fact, the blood supply of the liver is very unique. No other organ has that type of blood supply. You know, definitely all of us, you know, even if you are not a student of biology, that arteries go into an organ. It carries oxygenated blood into an organ for its activities. And then it is drained through a vein back to the heart. But in the case of liver, apart from receiving blood from arteries and being drained by 3 veins that we can say right, middle, and left hepatic veins, there is an important vein which we don't call vein, they call it portal. That is hepatic portal vein. The reason is this, that instead of taking away blood from an organ, it supplies that organ. And that organ is the liver. And why is it so? It is so because digestive products and most of the other organs in the abdomen, it collects blood from them. And you know the blood collected from the intestine, for example, is not going to be pure. There are certain substances that are poisonous that will find their way into that blood system. And to be able to get this blood pure and to extract food substances that are needed for our growth, it has to first of all visit the liver. When the liver has done whatever it wants to do with the blood being carried by the portal vein, it now sends it out to the 3 veins to be carried into the heart. The liver is okay. I've mentioned everything. Next slide. Well, that one is just to confirm what the psalmist say, that I am fearfully and wonderfully made. Can you see? Can you see the arrangement? Can you see that as heavy as the liver is not falling on top of the intestines, because it is hung securely in its position, and that is the stomach. All these organs, the blood that comes from them has to go through the portal vein to be purified before it is sent to the heart. Next slide. That's just an enlargement of what I've said. Next one. Yes, to be able to understand the functions of the liver, let us take the liver as a factory. A factory that manufactures goods. Now, that means there are 3 things a factory will do. It will produce. It should also be able to have raw materials that are needed for its activities. And then it should be able to have a department of quality control. And that is what the liver is. Now, next slide. Functions of the liver as a producer. The liver produces bile for the digestion of fats. It is stored in the gallbladder. It produces albumin, a protein found in blood plasma. Also, if you don't know what albumin is, it is the white of the egg. Many people don't like to take it because it's not sweet. They take the other one. But it is the most important part of the egg, albumin. And it regulates the osmotic pressure, ensuring balance between the circulatory system and the tissues. It also binds some substances acting like the transporter of these substances, like hormones, bilirubin, fatty acids, and some drugs to where they are used. Albumin. We'll talk about albumin later when we are dealing with the symptoms of liver failure. Cholesterol, which carries fats through the body. Then glucose from glycogen when it is needed in the tissues, especially during physical exercise. Immune factors which help fight infections in the body. Production of anticoagulants and coagulant precursors. Next slide. Functions of the liver as a warehouse. The liver stores protein and protein substances which are converted to amino acids and vice versa as needed. The liver also stores glycogen from excess glucose in circulation, excess fats from small intestine, cholesterol from fat metabolism, iron from ingestion and breakdown of red blood cells, copper from ingested foods, and vitamin B12 and fat-soluble vitamins of A, D, E, and K. Functions of the liver in purification. The medical term for that is detoxification. That is removal of poisonous materials so that the body will not be poisoned. And waste clearing. The liver filters all the blood in circulation, breaking down poisonous substances like alcohol, medicines, hard drugs, waste products of normal or abnormal metabolism. It breaks down fat globules into smaller droplets by mixing them with bile so as to enhance digestion and absorption of the fat globules. Many of you will wonder, why is it that when you have fat, especially when our women have just come from the market, they want to wash the meat. You see fat layers on top of water. That's it. But for this fat to be more soluble and absorptible in the intestine, it is the liver that does that, purifying the fat so that it can be absorbed, digested and absorbed. Next slide. Bile produced by the liver changes the acidic medium in digested food from the stomach to alkaline medium so that the digestive enzymes in the duodenum can function optimally. What that means is that the acid that is responsible for digestion in the stomach must not get to the duodenum, which is the next stage of the gut. And for it not to damage the intestine, the duodenum, to cause another ulcer there, it is the bile that neutralizes it and turns it to alkaline medium. Common diseases of the liver. Well, we have the viral hepatitis A virus, hepatitis B virus, as I have labeled there, 5 of them. I have the liver cirrhosis, the liver cancer, then benign tumors of the liver cysts, liver abscess, metabolic damage to the liver, and aflatoxins, liver damage. Next slide. Before we start to discuss the diseases in detail, let us look at there are general symptoms for liver failure. And so anytime that the liver is diseased, these are the symptoms that will show up. So we have common symptoms. Common symptoms mean that you can also have it in malaria. You can have it in typhoid also. Fatigue or feeling tired or weak. Jaundice, yellowness of the skin and eyes due to bilirubin buildup. Abdominal pain or discomfort at the right upper quadrant, that is where the liver is situated. Nausea and vomiting, loss of appetite, weight loss, dark urine due to bilirubin buildup, and pale stools, clay colored. Then these ones are peculiar to the liver. Ascites, that is fluid accumulation in abdomen. Even though in heart failure you can also have ascites. Edema, swelling in the legs and ankles. Bleeding tendencies due to clotting factor deficiency. Confusion, that's hepatic encephalopathy. That's a neurological change. Now, let me explain all these, especially those symptoms that are common in liver failure. Ascites is collection of fluid. And you remember albumin that the liver manufactures. It maintains balance between the water in the fluid and the water in the blood. Or we say fluid in the tissues and fluid in the blood. So when the liver has failed, there is no longer albumin to do that. And so you see water migrating into the tissues. And the abdomen is the best place for them. There is a lot of space there. Water will just be accumulating because albumin is no longer being produced by the liver. And that is also edema, swelling of the legs and ankles. Then you also remember that as part of the functions of the liver, that it manufactures clotting factors and things that will make bleeding to be controlled in the body when it is not outside the body. So when these coagulation factors are precursors are deficient, there is bleeding tendencies due to clotting factor deficiency, because the liver is the manufacturer and is no longer manufacturing it. Then confusion. You remember I said the liver removes toxins, that is poisons. So these toxins, when the liver has been damaged or is no longer functioning, now finds their way into the circulation and gets to the brain. And so that's why you have the confusion. Hepatic encephalopathy. It only means the disease of the liver related to the brain. And you have neurological changes like confusion. The person will just be behaving like a mad person. So spider angiomas, vascular lesions on the skin. If you look at the tummy as it's blown up, you see a picture like the spider. These are tiny veins that have been enlarged as a result of hepatic hypertension. That is, as a result of the buildup of tension in the liver. You see it, and it looks like a spider. That's why they call it that name. Okay, next slide. You are right. That is it. That is ascites. You can see the demonstration. Too much fluid in the tummy, to the extent that the tummy becomes the tank, and now it's supplying a bottle. So that is collection of water in the abdomen. Next slide. So fluffy hair, we are continuing with the symptoms of liver disease. Fluffy hairs due to protein depletion in the body. I told you that the liver manufactures albumin. So if the liver fails, there is not much protein for you to have a supply at the root of hairs. So that's why they become fluffy. Like it is like the hairs are dying because there is no food for them. Then we have whitish nail. Leukonychia is the medical name, due to reduced protein also in the blood. Then enlargement of breasts in the male, called gynecomastia, because some of the hormones that are manufactured, even if they are manufactured elsewhere, the albumin is responsible for transportation of these hormones, including the sex hormones. And so when the testosterone has reduced, that is why you now have enlargement of breasts in a male. There's testicular atrophy also is because of the testosterone that the albumin will carry. There's splenomegaly, the enlargement of spleen. The neighboring organ, or if you have the liver on the right side, the spleen is on the left side, protected by the cage. Both of them protected by the cage, by the lower cage. So let's discuss quickly the viral hepatitis. When you hear ITIS in any form of word, it means the inflammation of that thing. So the Greek word for liver is hepa, H-E-P-R. So when you say hepatitis, it means infection or inflammation of the liver. And notably, we have 5 viruses that can affect the liver: A, B, C, D, E. And diseases that they cause are named after them. So you have hepatitis A virus, HAV, hepatitis B virus, HBV, and so on and so forth. But hepatitis can be acute, short-lived. And when I was preparing for this, I said 6 months. If another disease is existing in the body for 6 months, it's going to be chronic, or you even call it chronic. But for the liver, because the liver has the tendency of fighting itself whenever it is abused, until it will capitulate when it can no longer fight anymore. So we give a period of 6 months for for acute hepatitis, but after 6 months, then it becomes chronic. In some cases, it will get to cirrhosis, as we will see. Next slide. So acute hepatitis can lead to death, get resolved. Like I told you, the liver also is fighting, or can become chronic. That's we call chronic hepatitis. Chronic hepatitis is usually asymptomatic, even though there is continuous destruction of the liver. Chronic illnesses are very bad. It is that they kill the person gradually, and the person will not know. In acute cases, you will have the symptoms that are so disturbing that you have to seek medical help. Chronic hepatitis may lead to the replacement of the liver tissue by fibrous tissue or scar, leading to liver cirrhosis and or liver cancer. Next slide. Next slide. So treatment for hepatitis A is supportive, as there is no specific drug against the virus. And prevention of hepatitis is through provision of safe water, improvement in hygiene and sanitation, and then there is vaccines for hepatitis A. It is not part of NPI program, but it is available. Next slide. Hepatitis B. We are going to have extensive discussion on hepatitis B because it is very, very common. Okay, this is the most common of all viral hepatitis. It has affected over 2 billion people worldwide. Hepatitis B infection has been designated as an international public health challenge, with 254 million people having chronic hepatitis B infection in the world today. And there are 1.2 million infections every year. 1.2 million. It causes about 1 million deaths every year, largely from liver cirrhosis and hepatocellular carcinoma. At least 8 out of every 100 Nigerians have chronic hepatitis B infection. Hepatitis B virus is the most common cause of liver disease, like I just told you. Next, in Nigeria. How do we get hepatitis B? Routes of transmission. If you know how people get HIV, because many people are familiar with how HIV is contacted, it is the same way. Because hepatitis B virus is blood-borne, it's in the blood. So, and the hepatitis B virus is about 100 times more infectious than HIV. 100 times more infectious. And about 50 times more infectious than hepatitis C virus, which is also a blood-borne virus. It's transmitted through blood contact. The virus can survive for at least 7 days outside the body. So it's a very strong virus. 7 days it is outside the body. By the way, do you know that viruses are not living things? They are not like bacteria. It is when they enter the body of the host that they now take control of the cell of that person. They take control, the nucleus becomes pushed aside, and they are now the new nucleus controlling the replication of the cells. So this means that when you have a body fluid that has been contaminated, when you have an article that has been contaminated by the body fluid of somebody who has hepatitis B virus, it can still infect somebody 7 days after, because they are particles, they are not living, so it's going to be there, and it has the power to start growing whenever it ends in the body of somebody. Well, this is important to those who go to get pregnant or are pregnant. There's a which we call vertical transmission, that is mother to child, and that usually takes place during delivery, when the placenta separates and the blood of the mother and the blood of the baby can mix together, and that hepatitis B is transferred to the baby. Next slide. On-screen blood transfusion, I don't think that is common anymore. Lagos State is very good, perfect in that, because you cannot just get blood to transfuse. You have to go to Lagos State accredited centers to obtain blood, and the pints of blood you obtain would have been screened. Then unprotected sexual intercourse. This, however, is not the main route of transmission in our environment, unlike what we have in HIV. So management of acute hepatitis B. The management of acute hepatitis B is supportive, and even when symptomatic. And this includes bed rest, avoid potential dangers of transmission, unnecessary medication, taking of alcohol and herbs that will weaken the activities of the liver. Most of the adults with acute hepatitis B will clear infection before 6 months. So once in 6 months the infections are cleared, then there won't be any problem. But if after 6 months the infection is still there, it is likely to progress to chronic infection. When hepatitis B is severe, liver transplantation is the definitive treatment. In fact, what we are saying here is that there is no cure. All of them, from hepatitis A to E, there is no cure, except maybe hepatitis C, but we get there. Next slide. Next slide. Okay, there is no cure for hepatitis B. I've said that. Intense research going on. However, available are drugs that can suppress the virus, such that the possibility of a liver disease is drastically reduced. drugs that can suppress. Not that it's going to kill the virus. It is just going to give a little power to the liver. So that as the virus or the viruses are waging war on the liver, the drug will help the liver to also wage war on the viruses that are in the blood. Preventive measures against hepatitis B. Well, if you know how you get it, then you will know how you prevent. Do we have to waste time on this? Well, for those that bring it back. For those that must do ear piercing, you can do it in hospitals where healthcare workers can use sterilized needles to do it. There are also earrings that do not even need a hole in the ear. We have a hole in the ear. Some people are now going to hole in the nose. So they have a double tendency of being infected. Is anybody having nose? Okay. So, because I saw somebody saying something. The use of such should be, there are also, the use of earrings that you don't need a hole, just press it, pam, and then you are as beautiful as ever. Injection safety. Needle or syringe should never be reused. People should not share blades, nail cutters, clippers, and other sharp objects. Every male should have his personal clippers for barbing. People should get blood transfused in health centers where the Lagos State must have ensured that the blood is okay. And fidelity should be encouraged in marriage. Next slide. There is a vaccine for hepatitis B infection, and so people can be vaccinated. Vaccination is very effective in the prevention of the infection. The vaccine is widely available in Nigeria, so it is even part of the NPI. So that means even babies can have it. The first dose should be given to the baby as soon as possible after birth, but preferably within the first 24 hours of birth. Other doses are given as part of pentavalent vaccines, that is 5-in-1. Hepatitis B is included. All children born in Nigeria should be vaccinated against hepatitis B, irrespective of hepatitis status of the mother. Adults in Nigeria are to screen first. It is only when you are negative that you go for the vaccination. If you are positive, what else are you worrying yourself for? God has already immunized you by himself. So only those that are negative for hepatitis B should go for vaccination. Please note the following about hepatitis B infection and its management. It is not right to tell patients with a symptomatic chronic hepatitis infection not to take protein in their food. Many, well, I won't call them doctors. There are many fake doctors in the market. You see them carrying swig, taking the blood pressure of people. So I don't think any doctor will say that someone with chronic hepatitis infection should not take protein, because even the protein is part of the thing that the blood needs when the liver is failing. Most of these patients have normal liver. Protein dietary restriction is only used in patients with severe form of liver failure. The symptomatic patients with chronic hepatitis B should eat a balanced diet. 2, it is important for people with hepatitis B infection to stop drinking alcohol. Alcohol can work against the recovery of that liver. That is, alcohol works. Alcohol is the friend of that virus. So that the virus is there, the alcohol is there. The virus will welcome the alcohol and say, thank you, we are here. Now we can work together to finish this man. So it is wrong to label people with hepatitis B as being sexually promiscuous. No, because there are other sources of infection. So while hepatitis B can be spread sexually, the role of sexual transmission is minimal in our environment. Next slide. Premarital screening for hepatitis B infection is good and should be encouraged. Premarital screening for hepatitis B should be done at least 6 months before the date of the wedding. This will allow the positive partner to be evaluated and the negative partner to be vaccinated, following the conventional schedule well before the wedding date. It is wrong to discriminate against people with hepatitis B infection, especially at work. Many of these people have been denied jobs wrongly in the military, in the banks, and food industries, because if you say, you have hepatitis B, you will contact our customers when you handle food. No, hepatitis B virus infection is not spread through food or water or casual contacts, such as sitting together, hugging, or shaking hands. Next slide. Vaccination against hepatitis B does not give hepatitis B infection. No, unlike in the when the COVID-19 came, they said, if you have it, you will have the COVID-19. No, it is the same thing with hepatitis B. What happens many times is that people will go ahead to vaccinate against hepatitis B without first of all checking if they have the virus already. In other words, somebody who has the virus already, he doesn't know, and now goes for vaccination, and then the hepatitis B now becomes full blown. Then he will turn to accuse the vaccine as the one giving him the hepatitis B virus. You know, the vaccine of hepatitis B is actually a weak form where they have weakened the germs, the virus, and then inject it, and the body will think it is still the same virulent virus, and will start to fight against it. And you know, antibodies will then be formed to protect the person against the active hepatitis B. Vaccination does not treat infection, as you know, it's not useful for those who are already infected. Adults who need to be vaccinated against hepatitis B should not take the vaccine meant for children. The dose for adults is different from the dose for children. It is also not good to shortchange our children. Hepatitis B vaccines are available and affordable for every average Nigerian adult. So there are still 4 more to go. So I will round up quickly because of our time. Hepatitis C virus affects 50 billion people worldwide and responsible for 242,000 deaths globally. Yes, about 1 million new infections occur annually. The prevalence of vitamin C virus in Nigeria is about 1.1%, very low, though higher in some states in the middle belt of the country. Hepatitis C is essentially a blood-borne infection, just like hepatitis B, and it's spread the same way like hepatitis B. It causes both acute and chronic. Acute hepatitis is usually asymptomatic. Only about 20 to 30% of people will clear acute hepatitis C. In other words, 20% to 30% of the population, their bodies will fight and will win the battle. So the virus are cleared from their blood. The remaining 70 to 80 will proceed to chronic hepatitis C. Chronic hepatitis C can lead to liver cirrhosis also, or hepatocellular carcinoma, or cancer, cancer. The clinical features of hepatitis C are not distinguishable from other forms of hepatitis. In addition, hepatitis C commonly affects other organs. That's the difference. As brutal as hepatitis B is, it will just affect the liver only. But in the case of vitamin C, it can affect any other organ. Oh, sorry, let me check the last. In addition, hepatitis C commonly affects other organs in what we now call extrahepatic manifestations. All patients with current hepatitis C infection should be treated. Hepatitis C is curable. That's good news. Hepatitis C is curable. The drugs are available in Nigeria and relatively affordable. They are called direct-acting antiviral drugs, DAA. But no, it's not that you now go to the chemist and be looking for DAA. It must be prescribed to you by a doctor. So don't go to the chemist and say, I want to buy DAA. You will not have it sold to you. The duration of treatment varies from 12 weeks to 24 weeks. depending on whether the patient already has liver cirrhosis or not. Next slide. Those with hepatitis C and liver cirrhosis should continue with surveillance for liver cancer even after the cure has been achieved. There is no vaccine against hepatitis C virus infection. Preventive measures are the same, like that of hepatitis B virus. Next slide. Hepatitis D virus is not a complete virus. Yes, it's not a complete virus. On its own, without the help of hepatitis B, it cannot do anything to anybody. So, if someone has been infected with hepatitis D, it will not be there. So, unless the person has had hepatitis B infection. So, that means hepatitis B and D, they work together. So, hepatitis D causes both acute and chronic hepatitis. These are not distinguishable from other forms of hepatitis, except that they are more severe. You know, it's the combination of two viruses now working inside somebody. Serological tests to differentiate, well, there is a strip that the lab uses to differentiate between HBV and HDV. Vaccination against hepatitis B is effective against hepatitis D, and the mode of prevention is the same. Next slide. Hepatitis E, about 20 million cases of hepatitis E occur yearly in the world. It is spread through food and water. Can we remember another virus that is spread through food and water? Fecal-oral. That's hepatitis A. So it is spread through food or water. Fecal-oral transmission. This is why it is common in areas of poor sanitation and hygiene. It consists only acute hepatitis, except in rare occasions that it becomes chronic. It can be severe in pregnancy with grave consequences for the mother and the child. Diagnosis is by serological test. There's a strip that they can use to check hepatitis E, although because it's not very common, most laboratories don't have this strip. No specific antiviral medication for hepatitis E virus, though ribavirin and interferon can be used, like it's always used in most viral infections of the body. Vaccine against hepatitis E is available in some parts of the world, but not in Nigeria. Next slide. Liver cirrhosis. This is a situation where the liver has tried to fight the illness. It's not only viral infection, even some other alcoholic fatty acid and so on. The liver has been trying to overcome the disease, but it has now surrendered. And part of the surrendering is that even the normal liver cells are now getting scarred by chronic inflammation. And when the liver cells are scarred, they cannot do the normal function anymore. So, the result of persistent injury to the liver is not able to perform its functions anymore, and it can lead to liver cancer. Liver cirrhosis could be asymptomatic in the very early phase. Next slide. Yeah, that's the difference. You can see the healthy liver, you can see the one that is cirrhotic, even with the lobules of scars all over. Next. Well, treatment of liver cirrhosis, let me just summarize that there is no treatment, except you will remove the liver and put another one. It is what is done in some parts of the world, but I don't think there is any liver transplantation that has been done in Nigeria. I don't know. Maybe Dr. Eneyu can enlighten me after, when I meet him after. I don't know. So, sorry, go back. If they want to do, why are we talking about something that is not in Nigeria? Go to the next slide. Cancer is an abnormal growth in the body that does not subject itself to the control system of the body. There are two forms of liver cancer. The one that originated inside the liver itself is the owner. The cancer has attacked it directly. But you have the secondary type that has come from other organs and carried by the blood. Even the portal the hepatic portal vein cannot remove cancer cells, despite all it does to pass poison something into the liver. And when the cancer cell gets to the liver, rather than even the liver attacking the liver, the cancerous cell, it now have that cancer, that cell, joining its own cell, and the cell begins to multiply anyhow, and so you have secondary liver cancer. Next slide. Yeah, that's just a picture showing you what cancer cell can do. You can see the fine liver that I showed you the other time compared to this one. So this one is already going. Next slide. We have the benign tumor. Benign, the word benign means not harmful or not dangerous. So just like tumor is just an abnormal growth, like a swelling or something. So you have that also in liver. They are common in females who use hormonal contraceptives. They are usually asymptomatic, although they can sometimes cause pain or rupture. The treatment is to do nothing, though they can be removed if they cause symptoms. One thing with the liver cells is that they are able to regenerate back. If you cut a little portion of the liver, it has the tendency of growing back again to the same size that it was before cutting. Liver cysts are fluid-filled cavities, and they sometimes occur in the liver. Simple cysts are usually discovered incidentally while doing abdominal ultrasound. The simple cysts are common in women above 40 years. They are usually asymptomatic, and the treatment is to do nothing, though they can be removed if they cause symptoms. One notable liver cyst is hydatid cyst that are caused by parasites transferred to humans from dogs and sheep. Liver cysts can also be part of polycystic kidney, of the polycystic disease of the kidney, which is a genetic disease. Cysts can also be cancerous. Liver abscess, we all know the common boil that our people will put palm oil so that the apex of it can be soft and they can be able to press. As a matter of fact, they will not come to the hospital because they want the boil to continue to grow, because they believe that when they come to the hospital and they are giving drugs to minimize it, that they have failed in their duty, that they ought to allow the boil to grow well and then for it to now burst by itself. So boil is an example of an abscess. So when you have something like that in the liver, it is called liver abscess. Common causes liver abscess, bacteria or parasite called amoeba, or it can also result from trauma when the instrument that has pierced the liver is not sterile. Depending on its cause, it may be single or multiple. Even though liver abscess is rare, it occurs more commonly in those that have diabetes and immunosuppression. Symptoms of liver abscess include right upper quadrant abdominal pain, fever, yellowness of the eyes, and urine. Treatment includes antibiotics with or without surgery. This one is curable. Liver abscess is curable. I can say that one authoritatively. The metabolic damage to the liver from excessive consumption of alcohol, from excessive deposition of fat in the liver, that is called fatty acid, or even from drugs, substance abuse, cocaine, heroin, marijuana, and herbs, all of them can damage the liver. And then the liver now goes through the stages that we have mentioned before, and then to cirrhosis, to cancer, and to death. Aflatoxins, I will not talk much on this, but okay, we are still talking about the liver is the easiest and most affected organ by alcohol. Liver is the primary organ for the metabolism of alcohol, and it gets damaged while doing this. Not everybody that drinks alcohol will develop alcoholic liver diseases. This depends on the amount of alcohol taken, the duration of the drinking, the sex, then comorbidity. Comorbidity means are there other diseases in the body like diabetes that can help this liver to go damaged, and genetic reproduction among others. Alcoholic liver disease is a spectrum consisting of fatty liver and alcohol hepatitis and alcohol cirrhosis. I want us to finish so that we can have about 5 minutes to ask questions. So alcoholic fatty liver, well, it is just excessive accumulation of fat in the liver as a result of excessive alcohol intake. Affects most of all heavy drinkers. It may progress to other more severe forms, especially if drinking continues. Abstinence may reverse it back to normal. This usually has no symptoms, but the liver might be bigger than normal. Next slide. Next slide. Well, I don't want to dwell too much on this. Abstinence is the key. Then you make sure that you eat well, and we have said that vaccination against viral hepatitis is available, treatment of other causes, and so on. Next slide. Aflatoxins. Yes, I want to talk a little bit. You know, some people are in the habit of eating groundnut. They like it. But you see, for every food, there is an expiry date. It is only in Nigeria that they don't put all these things. You will buy groundnut in a bottle. Even to be sure that it is groundnut, you don't know. You only look at what is there and say, this is groundnut. In developed countries, it has to be labeled. They will label it groundnut, expiry date, so. So all these nuts and grains now develop some growth, fungus growth in them, and some people will even clean the fungal growth before putting the groundnut into their mouth. You are taking poison, something that is poisonous to the liver. That is what we call aflatoxins. So it can damage the liver, produced by fungi that grow on improperly stored nuts or grains. Evidence abound that many staple food in Nigeria contain aflatoxin concentration above the safety limits. You can see many staple foods in Nigeria. Massive exposure to aflatoxin leads to aflatoxinosis, which is a form of liver injury. Long-time gradual exposure leads to liver cancer, especially in people who already have hepatitis B infection. So you are warned today that when you buy your groundnut, make sure that this whitish something that you see, or this grayish white, make sure that you doesn't have it before you pay for the bottle of groundnut. Individual can reduce their aflatoxin exposure to some except by avoidance of rotting food, especially grain and nuts. Even eba that you didn't finish last night, you store it for 3 days. This already has this thing that we are talking about. Next slide. I'm seeing a very good reaction. People are discussing the occasion they went to the supermarket and they managed to eat the granules. Such granules are usually soft when you throw them into the mouth. Whereas the one that is good, you will see that your teeth are cracking them. Okay. Take home messages. I am finishing now. If you have not gained anything because of this long lecture, this one, just take root of them and you are fulfilled concerning this medical Sunday. Check your hepatitis B status at least once in your lifetime. Why we say lifetime, it does not mean that after checking the hepatitis B cannot infect you. But a wise person, after checking and they say it's negative, will now go to the vaccine center to get the vaccine. And once you get one shot of the vaccine, you are saved forever from hepatitis B. That's why we say lifetime. Get vaccinated if negative. Avoid exposing yourself to risks of its transmission as stated earlier. That's if you are not vaccinated. If you are vaccinated, you have nothing to fear. Get evaluated by a doctor knowledgeable in hepatitis care if you are positive. Avoid taking alcohol. Avoid smoking. Check your hepatitis status at least once in a lifetime. avoid exposure to its roots. Next slide. Pregnant women, make sure that you go to a center where they screen you for hepatitis B. So if you have hepatitis B, your baby will be protected because they will get ready for that baby. So as soon as the baby is born, they will give. Parents, your children to be encouraged to go for routine vaccinations as scheduled in the NPI. Girl children should not be circumcised. I don't think there's anybody here that sees circumcises the daughters. Boy child should be taken to the hospital for circumcision, where sterile equipment will be used. Girl children should have ear or nose piercing done. I would have removed the nose piercing, but I just left it for the sake of those who still love it. Done. If it is the preference of the parent, in health facilities where sterilized equipment is used. Avoid the use of unprescribed drugs as much as possible, and take those prescribed according to medical instructions. Overdosage of drugs, especially paracetamol, can cause liver damage. This common paracetamol that we take. In fact, there was a paper released on paracetamol recently that was sent to my WhatsApp. Paracetamol can be dangerous if taken too much. Avoid the use of, regular exercise and balanced diets are good for the liver. Refrain from the use of unverified herbs and supplements. Maintain healthy weight. Thank you. But before I go, thank you. If you want to clap well. Before I go, I want to remind you of the need for us to take care of our health. If I ask you, which of us here budgets for his or her health every month or in a year? Okay, if you are the person, let me see your hand. Sorry, Pastor. If you have a budget, a special budget for your health or the health of family, let me have your hand. Eh? Oh, you have a health plan. Okay. Now, if you tell people, come and budget for your health, they will say, budget for illness. God forbid, not my portion. You see, this is one of the things. If God is saying that, I wish that you prosper in health, you have to do your own portion, because faith without works is dead. So I want to introduce to you today the Lagos State Health Scheme. Lagos State Health Scheme will help you to budget for your health. With as small as 15,000 in a year, you are entitled to everything, even including blood transfusion, even including CS, even including fibroid removal or any special, like they can refer you to the dentist, they can refer you to ear, nose and throat surgeon with 15,000. So why don't you take advantage of that? My sister called me yesterday and said that my brother, I've been stooling since 3 days. I'm vomiting. I said, I gave you the opportunity, go to Lashma and register. 6 months ago that I will pay. It's not you, I will pay the money. So she did not go. And yesterday, we have to spend over 100,000 to restore her. Something that we would have paid 15,000 for Naira for. So, my brothers and sisters, take advantage of this wonderful program from Lagos State. If you want to be included, Brother Victor, Brother Victor has a sheet that just puts your number and your name. The number that has WhatsApp. But if you don't have WhatsApp, don't worry, I will call you. So, if you are interested, just write your name and we will ensure how. Just like John said, I wish above all things that you prosper in health. I wish above all things that all of you will put your name down so that we can take your names. So that we can take your names to Lagos State and they will register you. If you register before 23rd of October, by November, you can go to any hospital around. You can pick any hospital around your area, and any chemist around your area. So, God bless you as you do that.
Do you have questions? Questions? Let me see your hand, please. Number 1, Brother Diaga. Number 2, Dikinesha. Number 3, Brother Sheung. Number 4, Dr. Frobo Kweta. Number 5, Deacon Adebayo. Only 5. But before, let me ask my own, sir. You have answered some of them as we were going. The blood transmission that you said can cause hepatitis B through some other form. What of mosquito bite?
Okay.
I'm coming, sir. Then the second one, enlargement of breast in men. Which one will you know? Is it the one that has body, that the chest is a bit, or okay. How do you know that?
How do we diagnose? How do we know that this is
yes,
gynecomastia? Okay.
Thank you,
okay.
sir.
Let me take the gynecomastia first. That one, you can know a fake breast. I will call the breast of a man fake because it doesn't have the correct features as you have in the female. Now, if somebody has body, you will the man will have a slightly bigger breast. But by the time you examine, in fact, you don't even look for breast first in liver failure. Other things would have come before the breast will start to enlarge. Other things. In the first instance, the liver will be large. You cannot feel your liver below this last bone here because the liver is hidden in the chest cage by God to protect it. So when the liver now goes down into the tummy that you can press and feel the edge, you already know that the liver is failing. So if that person now has big breast, it is safer to even say that it's gynecomastia than to say the man is just fat. It's normal. So as for mosquito bites, thank God. I started wondering too why HIV does not affect everybody. Because the HIV patient that is sleeping in the ward with a normal patient, where there are plenty of mosquitoes, the other patient would have gone home now with HIV infection. But thank God that the mosquito that has sucked the blood, God has made it that the blood that is going to spit into the normal person will have been altered. Perhaps maybe mosquitoes can kill HIV. So if the medical research says that we should gather all the mosquitoes in our house and sprinkle it on our soup and eat, because we will have immunity against HIV, we will wait and see. Who is next?
I want to ask a question. I have a case study of someone who, over time, lost strength completely and refuses to go to the hospital.
Sorry, I'm not hearing well. The thing is breaking, just like my telephone.
He practically has lost strength. He can't even walk. This person I'm talking about, he cannot walk. If he must move from one location to another, they have to hire Okada to take him down. Now, he does not go to the hospital. I've never heard him in the last 20 years saying that he's going to the hospital for his start. And he takes more of this alcohol, this sachet something. He's an iron bender. And, out of ignorance, he does a lot of things out of ignorance. So I do lecture, take a group of health students, and this was discussed in the class yesterday. So I'm just putting it back to you, sir. Is the liver affected somehow? Because when you lose strength, you lose weight, perhaps it's a symptom. I just want to know, sir.
Okay, Brother Muiwa, if I heard you well, you are talking of a particular case that is losing weight. What else? Is losing. He gets easily tired. And he cannot walk. He drinks a lot. Sorry, I may not be able to fix a diagnosis because I have to examine the patient. But let me tell you that you have said that he drinks a lot. That is alcoholism. And it is likely that that person will have what we call fatty liver. And fatty liver is full of fat cells. The normal cells of the liver that perform functions to send glucose into the system for energy, to make glycogen to be stored in the liver when there is excess glucose, to get protein, to get albumin, to transport some of the things that can defend the body, are no longer there in fatty liver. So that is why he will get weak. But there are other things that can call weakness. HIV infection can call weakness and loss of weight. And you will not be able to walk. In fact, anybody that doesn't have energy cannot walk now. What are we talking about? You can't walk because you don't have the energy to walk. Even ordinary malaria can cause you not to be able to walk because of weakness. But if I can see the person, I'll be able to know if it is liver problem that he has or not. But because you said he indulges in alcohol too much, it's likely to be a case of fatty liver from chronic alcoholism.
Thank you for the enlightenment. My question is, what is the difference between being hypertensive and hepatitis B?
Sorry, what's the difference between
The difference between
the microphone is
being hypertensive,
being hypertensive,
yes,
and
hepatitis.
Yes.
The second one is this Lagos State Health Insurance, because those of us that are above 60, for insurance, they are running away from us. That they don't insure those above 60 years. So those above 60 years, can they register for this Lagos State?
Let me answer that one first. You see, they even have a special plan for the elderly. They have a special plan for the elderly. Sister Gbaja, I think you subscribe to Lagos State now. What do they call that one for the elderly?
I can't remember. It's for older citizens or some elderly, 60 and above. It's 34,000. It's 34,000 naira for the elderly.
Okay, but you call it exagera or something.
Not exaggerate. It is for adults.
Okay, so in fact, the Lagos State has a special program for that. That's why it's even a little bit costlier than the 15,000. Sister Gbaya said it's 34,000 because they know that the elderly is vulnerable to attacks of various types of diseases. So pay your 34,000 naira, and for the rest of the year, your health is taken care of. Whenever you receive drugs from the chemist, you don't pay a kobo. I have it, and even when I don't have headache, I will say I have headache, so that they can give me. That's just on the lighter mood.
Doctor.
So, to your second question, I said when you hear ITIS in any word in medicine, it means either inflammation or infection. You can't compare hepatitis, which is an infection, to to hypertension. They may sound the same thing, but they are not the same. They don't have the same meaning. Hepatitis is infection of the liver. Hepa is liver. ITIS is infection. Hepatitis, infection of the liver. Hypertension is a rise in blood pressure that is above normal. So they are not the same thing. And the treatments are not the same either. Number 3.
Sorry, sir. Can I quickly say something based on the last response? The elderly ones, like I complained to you, I was looking for a clinic that I can use. So I stopped renewing my subscription because I used rebates. They were treating me like second class. I complained it to you. So it is not all the clinics that take it up the way, it should be taken care of. So it deterred me from going forward. Although I've just put down my name again, but if there will not be good clinics that will be supportive of the government plans, they complain to me that the treatment I get is like no money next to, it's a terrible thing they are doing.
What's the name of the hospital?
Rebate there at Adejumo Lawn Tennis.
Those are the spoilers. You see, those are the hospitals that they want to make maximum gain. In my hospital, we know the way we take care of them, we are losing money. But because of our support, many of them, many enrollees, we want to come to us. In fact, LASHMA, that is the company responsible, the HMO responsible for this Lagos insurance, has recommended that those who are living around us should come and register with us, because we don't look at the profit. We want the scheme to succeed. Now, do you know that for every enrollee, Lagos State pays just 450 naira? Maybe they have increased it now to 800 or 1,000. You see, because in insurance, it is a collective payments of many people that they put together. So those who are well will take care of those who are sick with their money. I was going through the graph, was it last Monday, and I saw that a lot of people have enrolled with us, and every month we get paid maybe 800 now, 800 naira. Say about 2,000 enrollees for ease of calculation. That is 8 times 2. That is about 160,000, Abi. And we saw that very few people come. It's only when they are sick that they come. And if you admit a patient now, for the first day, they won't pay anything. It's now has to be the second day. So even when the patient is better, we say you can't go home, because they go say we don't pay us. We will discharge you the following day. Yeah, there are mosquitoes. Okay, don't worry. We will spray the place. Because we want to make sure that we too, we are not running at a loss. So it depends. But even then, you can report that hospital to LASHMA, and they either remove them or call them while you are in the hospital that I am not well treated. There is one, I've forgotten her name now. He will instruct them to do what they ought to do. But for the reason that you have given, it is not enough to say that you will get out of the scheme. Go to Isolo General Hospital. Okay, so it's noted. But Mrs. Ulaja said that he has re-enrolled. So I will monitor the service that they will give you. Just tell me if they are not doing well, or you come to my hospital. I will be collecting 800 naira on your behalf every month.
Thank you for the presentation, sir. My question is still related to hypertension. I have a colleague at work that has high blood pressure, but was detected very late. And somehow they are telling him it has affected the liver. So I want to know, is there any relationship between high blood pressure and the liver?
That's a very good question. There is. Okay, I can't get the slide number. Do you know that when cholesterol is too much, it clogs the inside of the arteries? And I've told you that it is the liver that produces cholesterol. So when cholesterol is too much, and that is why when somebody is going for checkup on hypertension, they usually say go and do cholesterol. And cholesterol can cause stroke when it is too much. There is good one, which is we call HDL, and the bad one, LDL. LDL is our enemy. When it is too much in the system, it even forms globules, fat globules. The globules that you remember that liver has turned to be soluble will now become little particles in the blood. And that one can get to the heart. If it gets to the heart, it blocks the artery that supplies the heart blood. And then you can have what we call myocardial infarction. The heart collapses. It can happen anytime. Somebody might be driving like this and he has heart attack. And the person dies on the steering. And you see the car going into the bush. And you are passing by and say, what's wrong with this man? He's drunk. It's not every one of them that is drunk. It is heart failure while driving. It can also cause stroke, where it blocks the supply of blood to the brain. And blood is no longer able to get to that type of the brain, maybe that supplies the right leg and the right arm. And the person will not be able to speak. It is cholesterol. So the liver, because it is the manufacturer of cholesterol, has a very great impact to play in hypertension.
Thank you very much for your lecture, sir. I think the first one is a concern. I found out that generally men are not very, very sensitive to their medical treatment, medical checkup, generally. I don't know why, so I said I'm going to ask. Because it seems women are more concerned about their health than men. That's just a concern. But my question is on liver cirrhosis. From your presentation, it's like liver cirrhosis. The emphasis has been on alcohol. But I've had some cases of some people in my family who had liver cirrhosis. But in the course of finding out why, I think they took a lot of antibiotics. I don't know whether it has a role to play in that. In the course, as a result of that, their liver collapsed and they had a liver cirrhosis. So I'm trying to say that you want as much as you cannot take a lot of antibiotics. So I just want to get a clarification on that. Then the last question is on the cyst for women. Why do women have cyst after 40 years? Thank you, sir. Have cyst. C-Y-S-S. Cyst. C-Y-S-T.
T-Y.
C-Y-S-T. Cyst.
Okay, ovarian cyst. Hey, but we are talking about liver cyst.
No, I spoke about liver cirrhosis, that's one. Then the second one is, you said women after 40 years, they have cysts. I say, why?
Oh, okay, well, they have liver cysts, okay. Let me take your first question, that it is true that men don't take care of their health. They take care of their wives instead. And you know why? They take care of their wives now. First, they will wake up and then look for work to do. They will stay at work for several days while the wife has already got you to take care of the children. Their wahala is too much. And woe to that person, to that man that just continues to do wahala and is not checking his health. I have some people here, every year, every year, like my friend SB Taiwo, every year he has a particular, I think it's during his birthday, he have to do all the checkups. Since the time that he was in WAEC, he has been doing it. And even after his retirement, he's still doing it. Such men will live long, obviously. But it's not the one that even has gone to see the doctor. And the doctor has said, 230 upon 120. You need to be admitted, doctor, can't I just take medicine? Because I have an appointment with at Abuja. And I have to be there. It's a contract they want to give me. The brother is thinking of the wife at home and the children. So he will go and collapse on the way and die. So you are right that men you have heard now, please take care of yourself. You can see now. It is known that men die before their wives. And that's why you have a lot of old widows. Now, old widows. No. About your second question, why do women have cysts after 40 years? I will tell you that liver cysts, that is the discussion of today. Liver cysts are not very common. You have seen when I said it. It is not very common. In fact, for the past, I don't think I've seen liver cysts for 30 years that have been practiced. Not either in a woman or in a man. Even when we say that contraception will cause liver cysts, it is also rare. And when you now ask me what causes it, I will say I don't know. But I don't have to know everything. I forgot that I have
Number 5. Sorry, I just wanted to add something to this issue of cyst. I think Dr. Dora is talking about other cysts in women, not liver cysts. Not liver cysts. So for women, ovarian cysts and some other things could occur. And I think it may just, it will have something to do with the hormonal changes in women. Yeah.
Thank you, Dr. Adam. Oh, antibiotics. Okay. Well, antibiotics. Firstly, you said someone has a liver failure from. When is it she or he? Okay. When she was sick. What caused the sickness?
She was on a high dose of chlorpheniramine that time when it was being used. So she was using it constantly for almost about 5-6 months like that. But she was not on alcohol. But from nowhere, when she went for tests, they say she had a liver cirrhosis. And that was what killed her. Actually, it's my mother.
Oh, okay. Sorry about that. Now, do you know that abuse of antibiotics is very common in Nigeria? Somebody has simple cough that you can just say cough mixture. He goes to buy Ampiclox. Some doctors, yes, but no doctor, no. You see, when you are talking about doctors, there are two types of doctors. We have fake doctors, we have real doctors. No, it is true, because when you first complain of cough for me, I will not give you antibiotic. If you come another time, I will ask you, is your cough productive? If it is productive, we have a sample to take to the lab. If the lab now recommends antibiotic, I'll give you. Otherwise, abroad, somebody went for prostate biopsy, and I had to send ciprofloxacin by DHL to him because they didn't give antibiotic for that. And the man was passing blood. I said, they didn't give antibiotics. He said, no. So I quickly bought it. I mailed it to him. And the thing stopped. You see, they are overdoing it abroad. But even then, if they do 100%, let us do about 30% by giving antibiotics to those who actually need it, not to everybody. Concerning the case you are mentioning, do you know that the chloramphenicol itself, they said it causes aplastic anemia. And that is why it has been stopped. But if you see, go to chemist, you see chloramphenicol. And because chloramphenicol is known to cure, or was known to cure typhoid. So, the chloramphenicol that I can't say per se that is the chloramphenicol that caused the liver cirrhosis or liver failure. But remember, you said he has fallen sick before liver cirrhosis. So that must be that the aplastic anemia that chloramphenicol caused that triggered the liver not being able to function well and now led to liver cirrhosis.
Okay, number 5 is 5A and B.
Okay.
5A and B, and I will explain as we go on. The concern and issues that I would have loved to raise about LASHMA, you've partly answered it, but I would like to call attention to the fact that you may have to come back to tell us how to manage that scheme. The treatment people receive, don't let me say, it seems is commensurate to the fee or the premium. And that is not what people want. If the premium has to go up and they get the best of service, that is what people desire. The comments that I've had would not be, I don't want to say too much here, but I would like that to investigate and come back to us to encourage more people to be able to participate. My namesake really have a question, so that's the part B, since mine has been partly answered.
So 5B, we planned a coup here. I am not so much of a senior citizen yet. By the church definition, from 65 and above, but Lagos State from 60, you are a senior citizen. Now those that saying they don't have an health plan, or they go to an hospital and they're not well treated, I will tell you, go to the general hospital. I registered there in Lagos. I've been going there, and I've been amazed at how they treat patients, particularly those who are senior citizens under LASHMA plan. Thank you.
Sorry, clarification. You have been amazed that they treated patients.
The way they treat them, no, very well.
Very well.
They treat all the old people.
You didn't add that one.
Old people.
Tell them.
They come. They have dates. There may be many. There is a room like Lagos. I think you have seen.
There's a section.
They have like 3-4 consultants in the room with those who doing housemanship, and they teach them. They attend to them. They go and they always smiling. Dr. Kini Mofelio, Dr. Kini today, waiting, go and take a temperature, and they're happy. So I've seen it, and I think we should take this opportunity if we can. Thank you.
Thank you, Brother Ake. It's contrary to what Sister Gbaja said. I said, go to Isolo General Hospital. He said, which means that place is worse. But I am telling you that if you register with General Hospital, they are not after gain now. So there is usually a section in General Hospital for for LASHMA people. So that means they are going to treat you specially because they know that they are serving the same government. Sister Gbaja, I was telling you that there is a contrary view to your opinion that General Hospital for LASHMA is not good. Sister Ake just gave a testimony that no reply. That he was specially treated at the General Hospital that he went to because there's a section and you even have consultants there. So if you are not pleased with any private hospital, go to the General Hospital nearest you. For my brother's suggestion that we have to come back to market LASHMA. We want somebody who has served meritoriously with Lagos State to comment on that, if he can help us.
Now, let me start with Sister Dora. That was what I wanted to comment on. all the other observations are interesting feedbacks to me. Right. Now, the most common cause of cirrhosis is herpes. So we have to take that seriously. Herpes, cirrhosis, and kidney disease. If you go to dialysis center, so many people there. All these so-called agbos we take. It's natural, it's this, it's that. You must understand compounds, or let's say drugs. When we were in university, kept doing chemistry, they will bring out, we do what we call chromatography, and they will bring tea, just a cup of Lipton. So we will analyze it. There are about 20-something compounds inside Lipton. You have the caffeine that we are looking for. Then we have other things. Some are mostly are neutral. They are not causing any harm. They are not having any effect. They are just for support. Some are positive, counteracting the effect of some fewer ones that are causing negative issues. That's why Lipton is safe. You can take tea. They have both some harmful, but they have some positive that neutralizes the harm. That's because it's well researched. You now go to all the other herbs that are not so-called research, and you keep taking it. Some of them have compounds that affect the kidney, affect the liver. And that's why we have a high incidence of liver and kidney problem in Nigeria. Since the days we were in secondary school, in university, if you still go to it's still the same. And that's the problem. It's not the chloramphenicol. Chloramphenicol or antibiotics, they have known effect. That's why it was withdrawn. Like he said, bone marrow depression. So your blood level will go down. And we have seen many cases. But when people don't know, they will just tag the something. Now, to the issue of Lashma, I think Lashma is a work in progress. I can't tell you all the things I know about Lashma, but let's say it's a work in progress. And the little I can tell you is the fear of the general hospital of those days. When I go there, this is no longer. So what we get, the feedback we get is that when you go there, you will be more surprised than disappointed. So you can try it. Thank you.
Thank you very much. I think with that, I will say that okay. Why is it that pharmacies usually sell drugs without doing physical examination? They're only based on complaints. But doctors will check before recommending drugs. You have answered your question. You said somebody is a pharmacist. He want to sell his drugs now. It's only his drugs that has not been sold for several things that he will pass to you. You say they will prescribe drug without checking. That is better for him now, not to check. So if you're complaining of fever, you can see that, okay, diclofenac that I've not sold, he will push it to you. And then the diclofenac will cure your fever. But as you are taking it every time, it can cause ulcer for you. Especially in those days, our mothers, when they used to enter buses and so on, somebody will come, maybe from a pharmaceutical shop, and say, this drug, it can cure catarrh, malaria, typhoid. It's just, if you buy it here, it is 500 naira. But if you go to shops, they sell it for 1,000. So people will start to buy it. To the extent that my mother, when he was alive, I checked her drug, this thing. I saw diclofenac in different names three times. The same, you say, how do you take this, Mama? I will take one from this, one from this, one from this. That's overdosage. So there are lots of drug abuse here. What does a pharmacy have in seeing patients? No. You go to the hospital first. Doctor will prescribe, and then you take your prescription to the pharmacy. In the developed world, you dare not just buy any drug from them unless it is by doctor's prescription. So that is the reason. The reason is that we are in Nigeria, and anything goes in Nigeria. So on that note, we want to thank you for listening to us, and we want to thank the pastor especially for the opportunity he has given us to have this day as our medical Sunday. So we thank you very much, sir. So and we hope that by God's grace next year we will have a full week, not just a day.
Okay, sir.
Thank you,
sir. The medical team, Dr. Olofinjana and others, God bless you. Thank you very much. There's one special announcement. How many of you have taken the hepatitis B vaccine, the vaccination before? Let me see your hand. Dr. Nyaye, we have not seen your hand, though. Okay, only very few in this church. Wow. Now, there is an opportunity for you to take it, not today. Is it the test? The test, sorry. If you have done it before, you don't need to take it. But they want to test for it, whether you have it or not. So how many of us have not done it before? Now, after the service, please make yourself available behind. Now, from what Mama is saying, after the test, if you find yourself negative and you want to take the vaccine, register with them. They will organize for the vaccine also for you. Are we okay with that? Okay. So, thank you. Again, I discussed with the diaconate that because there was a time we are planning medical, we have something for you again. There is this thing in the public space that the rate at which stroke is coming is increasing. Have you read that? And I've been approached that whether if we can just take few minutes to have that lecture. Before the year runs out, please, we are going to invite you again for a Sunday so that we can have that enlightenment. It's on the increase, and the government is not finding it easy to be able to attend to the problem. So before the year runs out, we are going to have that enlightenment also. We have a program now, and the church in conference that we did not hold in July, that we said this month we will hold. If we say we finish what we want to do and we enter into church in conference, we'll be here till around 2:30. Should we go ahead with it? Okay. The yes, the high, let me see, let me hear. The nay. Okay, but this is it. We are not going to wait till November.